Welcome to the video. In this video, you will get a perfect lesson about psychology of addiction. So don't skip the video and don't forget to subscribe the channel. Addiction. The word addiction is derived from a Latin term for enslaved by, or bound to. Quote, addiction involves craving for something intensely, loss of control over its use, and continuing involvement with it despite adverse consequences. Addiction changes the brain first, by subverting the way it registers pleasure, and then by corrupting other normal drives such as learning and motivation. Although breaking an addiction is tough, but it can be done. Today's psychology makes understanding addiction quite simple. When a person engages in an activity that is pleasurable, but cannot stop doing it, even to the detriment of everyday living such as work, hobbies, family time, finances, etc., and as a result, this behavior would be considered an addiction. A person who drinks to the point of alienating friends and family and losing a job, and continues to drink in spite of all this, is likely addicted to alcohol. Similarly, a person who has an uncontrollable need to gamble, even dipping into life savings to play, and wants to do nothing else but gamble is probably addicted to the risk and illusion of control of gambling. And many people are addicted to masturbation. Not only the drugs and gambling, but some activities through which we get away from the depressions and pleasure-producing and thrilling activities, and even masturbation can turn into addiction. How addiction occurs in human. To understand this, we are going to go through a little about neurophysiology and psychology of man. A neurotransmitter called dopamine, which produced insufficiently by dopaminergic neurons in midbrain and hypothalamus, is the absolute reason in addiction. Dopamine is an organic chemical of catecholamine and phenethylamine families. Dopamine works as a neurotransmitter to transmit an electrical signal chemically from one neuron to another, and to pass a signal from central nervous system. Dopamine is one of the feel-good chemicals in our brain. It is interacting with the pleasure and reward center of our brain. Dopamine, along with other chemicals like serotonin, oxytocin, and endorphins, plays a vital role in how happy we feel. In addition to our mood, dopamine also affects movement, memory, and focus. Healthy levels of dopamine drive us to seek and repeat pleasurable activities, while low levels can have an adverse physical and psychological impact. Neurotransmitters are defined as a group of chemical agents released by neurons. They transmit messages chemically. These chemical messengers link the brain and spinal cord to muscles, organs, and glands by sending signals to perform certain functions in the body. They also interact with specific sites, called receptors. They located throughout the brain to regulate emotions, memory, cognitive function, attention span, energy, appetite, cravings, sensitivity to pain, and sleep patterns. Imbalances in these chemicals impact our behavior and quality of life, and can create a vast amount of health issues such as anxiety, addiction, behavioral disturbances, cognitive disorders like Parkinson's disease, fatigue, hormonal imbalances, mood disorders, obesity, and body pain. Dopamine is one of the most prominent neurotransmitters that impacts human behavior. When we experience pleasurable events like eating satisfying food, sexual activity, and even masturbation, or drug use, our body releases dopamine. Our brain then associates the release of dopamine with pleasure and creates a reward system. For example, when you eat comforting food, your brain releases dopamine, which makes you feel good. The dopamine also plays its roles in motor function, arousal, reinforcement, learning motor skills, and a very important role in motivation and rewarding experience, and chief role reaching euphoria. These process and skills are maintained and developed by binding with specific types of dopaminergic receptors present in separate areas of brain. Now the addiction is seen by steps. When we eating a favorite dish, or going for a thrilling bike ride, or playing interesting games in physical or by video games, the dopamine gets released to appropriate areas of brain, then it gives us pleasure, or thrill, in the form of rewarding by reading reward system, and it changes the mood from a depressed to joyful experience. This experience is stored in our brain, and how it happened to. Our brain even stores the smell, color, and ingredients of the dish, and the place where we had it, and in which limit we reach the thrill or euphoria. Later, the released dopamine gets decreased, and fade out. Then the brain recovered from dopamine's effect to get back to the normal state. While we are eating the same dish, on another time and on another day, or playing the same game. It remembers the experience of pleasure, and it elicits the same feeling of reward and happiness. And this feeling induces more desire to get it. While this process continues for prolonged time in order to get joy, it seeks for more quantity, and forces to engage in the game for a more time. Thus the addiction develops. And this stage is also coherence with masturbation. But in alcoholism, it is different in a little extent. Alcoholic addiction is severe than all other addictive behavior, because the alcoholic, or many other drugs like weed, cocaine, will flood the brain by releasing a huge amount of dopamine. It is like a shortcut to release large amount dopamines. So the brain dipped in dopamine. As the amount of dopamine increased, the time taken recover from its effect is become long. Also the huge dopamine produce an enormous experience of joy and reward. It makes the person reach the euphoria and more. Now the brain get adapted that it is the only way to escape from other problems and depression, and to feel a great pleasure, and it seeks it for more and again. When it not stopped for a time, the addicted person begins to engage in the activity severely, and he doesn't take care on end sequences, and other daily missions and important roles. So the dopamine changes the brain in severe like. The sufficient amount of drug to get a peak in intoxication for a person will increase so on. First the person gets the euphoria over by a small dose, later the brain asks for double of the amount, and later it increased to 10 times, and for more in several times. Not only the amount, and the way we are using will be altered in order to make the effects stronger. Our desire seek different way which will cause to severe intoxication. First the person drinks alcohol, then he try for smoking, then it pass to use cocaine or other drugs. It will leads to intake drugs by intravenous. This stage is very serious and uncontrollable. So please stay away from these. Which people are more prone to addiction, and why? According to researches on psychology and neuroscience, the following are the chief reasons for addiction. People who are more exposed to stress and depression are more likely to get addicted, and some people with more negative thoughts have a huge choices for addiction. And the reason is, the above people are busy in finding ways to escape from their stress and fear on negative incidents and to get relaxed. When they first engaging in the addictive activities, the previously watched steps in this video are happened in orderly steps, so they get involved and adapted to the addictive behaviors. Before finishing, please comment if you people need a video about recovery from addiction, and have subscription too. And please subscribe the channel.